Sarah. I'm going to be the speech student that's going to be doing the assessment on Sela today. So for starters, Sela, can you give me your full name?
Sela Grace Sheasley.
Okay, and when is your birthday?
May 19th.
Okay. I need that. I didn't have that, so that's good. What year?
2008.
Okay. Okay, so Sela is 9, so she's under 10 just for this project, and they had to be under 10 for it. And then this is her mom. She's going to answer the questions for the background. This is Mrs. Sheasley. All right, so for beginning with medical history, is there any significant birth history or complications, surgeries, or any like hospitalization she's had like since birth? No?
No.
Okay. Does she have any allergies to any medication? She said
She has a sulfa allergy.
Sulfa allergy, okay. And is she on any medications?
Just vitamins.
Okay. Does she have any neurological concerns or like any like prior testing she had, like an MRI, or any problems with muscle tone?
No.
No. Most of these are probably going to be no. But any previous or current cardiac problems?
No.
Okay. Any previous or current respiratory concerns, like any asthma or anything like that? Nope. Okay. Any previous or current like GI history or any renal problems?
Nope.
Nope. Okay.
She had bladder infections a lot when she was younger, so she saw a nephrologist, I guess.
Yeah.
And everything was fine.
Okay. Any concerns with any current issues with swallowing?
Swallowing, no.
Mm-hmm. And any issues with her gaining weight at any point?
When she was an infant, she was very small.
Okay.
Just like me? Yeah.
All right. Does she have any dental, hearing, or vision concerns that you know of? Okay. Any concerns with her motor development, speech and language development, or cognitive development?
No.
Okay. Have you noticed any alterations in smell? Have you had any difficulty smelling different smells or anything like that? Okay. All right. As far as current feeding, I mean, she feeds herself, so she has no problems with that. Any preferred foods that, anything that you prefer, like, over other foods as a favorite food?
I prefer cucumbers over celery.
Okay, that's fine.
She eats pretty much anything. What's your favorite food?
What's your favorite food?
Shrimp.
Shrimp? Ooh.
She's not picky.
Okay.
She does not like carrots at all. So that's the only thing that she will not eat.
I was gonna say there's a question coming up. In any specific like textures that you don't like to eat? Okay, so no, just the carrots, just for preference. Okay, no issues with swallowing, so she's not on any like thickened liquids or anything like that. Was there any history of feeding concerns when she was younger, like when she was an infant or?
No, she had food sensitivities. Like she was nursing, breastfeeding, so I had to cut milk out of my diet while she was breastfeeding, but she does not have any allergies or anything now. But she would projectile vomit every day for like a year of her life.
Oh my gosh.
I would say that's a concern, but she outgrew it.
Okay, sounds good.
She's good now. She's good now.
All right. And then on average, the length of a current meal time. So how long?
She eats pretty quickly. I mean, like an adult.
Okay.
And she stays at her seat the whole
Why are you
time.
guys down here?
Eats and then has to be excused.
No feeding concerns, you already addressed that. And for like positioning for meals, she normally just sits at the table and eats with everybody else. Okay. And her pediatrician hasn't expressed any concerns in the past about anything with like feeding, swallowing, anything like that.
No.
Okay. All right, well that's it for the question. So thank you for answering that.
You're welcome.
And we'll be on to the actual assessment.
That's
okay.
Okay.
That's fine.
Let me know if you need me.
Absolutely. All right.
Is there any way
We'll wait a minute for that.
Is there any way to cut that out?
We probably could. He might be able to edit this on the computer once we go home. That's okay. All right, so moving on, and I'm actually going to move this over so I've got some space to write. So what we're gonna, before I actually do the assessment, I would either wash my hands or I would use hand sanitizer. For this purpose of being where we are, just going to use the hand sanitizer. And then got a clean work area. I put a drape down, so I have kind of a clean area to work from, and then I'll put gloves on. And so first, what I'm gonna do is we're gonna actually assess the motor function of your face. So I'm gonna actually like assess how the muscles of facial expression, how you eat, like how you would chew, different muscles that you use to swallow, and your tongue as well, okay? So for starters, can you smile and frown for me? Good, now do a frown. I know, it's a little harder to do, but what I'm looking for is it's symmetrical on both sides, okay? And then the next thing would be to pucker your lips like you were gonna give a kiss or blow a bubble, kind of like this. Good. And then the next thing I'm gonna have you do is puff out your cheeks while you're doing that. And go ahead and hold the air there, and I'm gonna try to push it out and try to keep it in there, okay? Good. So what I'm testing for is to make sure that your muscles of your lips are really strong. The next thing is raising your eyebrows. Can you raise them? Okay, good. And then lower them back down. And then squint your eyes. Good. And then go ahead and wrinkle your nose. Good. So all of those were normal. All right, the next thing is the muscles of chewing. So when you chew your food up, I'm gonna feel around on your face a little bit and make sure that all of those muscles are strong. So the first thing I'm gonna have you do is just a relaxed bite. So just kind of bite down like you normally would in your mouth. So just not like hard, but just how you normally would, okay? Let me just feel right here. And then I want you to kind of clench real hard. Yep, you can feel the muscles clench on your sides. Very good. So both of those were normal. Next, I'm gonna have you open your mouth like all the way like this. And what I'm gonna do is I'm gonna push down. I'm gonna try to push your mouth closed, and I want you to fight it, okay? Good, make sure that's nice and strong. And now I'm gonna have you keep your mouth kind of half open like this. And then I'm gonna try to close it, or I'm gonna try to open it, and I want you to fight it, okay? Good, so I'm not able to open your mouth. Good, very good. All right, the next thing is measuring the distance between your top teeth and your bottom teeth, so your full bite. So I'm gonna have you open your mouth as wide as you can, okay? Good, and I'm just gonna measure from basically the top tooth to the bottom tooth. Good, so I got about 4 centimeters. All right, so next we're gonna do the muscles of your tongue, all right? So I'm gonna have you stick your tongue out at me, and then I'm gonna have you keep your mouth open and pull your tongue back, okay? Very good. And then I'm gonna have you wiggle your tongue side to side, so very, very good. And then I'm gonna have you open your mouth and elevate your tongue all the way up to the top of your mouth, like that, and then bring it all the way down to the bottom of your mouth, but inside, like that. Very good. Then I'm gonna have you like this. You know how you can take your tongue and stick it to the inside of your cheek? Like that? Yep. I'm gonna do it one at a time on each side, and I want you to push against my fingers, okay? Good. And then we'll do the other side. Very good. All right, so this next part is, I'm gonna use my little flashlight here, and I'm gonna shine in your mouth, and I'm gonna look at how all the parts of your mouth move when you make sound, okay? So the first thing I'm gonna have you do is open up kind of wide, and I'm gonna look in, and I'm gonna have you say, ka, 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 like that, all right?
Ka, ka, ka.
Very good. I know some of this might seem a little weird, but bear with me. Then the next thing I'm gonna have you do is just the sound ah, and I want you to do ah, ah, ah 3 times for me.
Ah, ah.
Very good. Everything looks normal. The next thing is testing your ability to like shift between sounds. So you're gonna, can you say pa-ta-ka?
Pa-ta-ka.
Now you gotta do it really fast, like pa-ta-ka, 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 a couple times for me.
Pa-ta-ka, pa-ta-ka, pa-ta-ka.
It's like a tongue twister. Do it a couple more times.
Pa-ta-ka, pa-ta-ka, pa-ta-ka.
Okay.
Pa-ta-ka, pa-ta-ka.
There you go. I know it's a little weird to do, but all right. And then after that, I'm gonna have you do a sustained sound, so a long sound. So you'll do, I'm gonna look in your mouth when you do it, but you're gonna do ah for a little while, okay? Ready? And then tilt your head back a little bit. Good. Good. And then I'm gonna have you do ee. All right, with your mouth open though, okay? All the way up. As hard as you can. Ee. All right, good. Now what I'm doing is I'm watching the roof of your mouth go up and down, and that's good. That's what you want to see. All right. Next thing is a glide pitch. So we're gonna go from real high, ee, down low. Can you do that?
Ee.
Good. And then bottom up. Ee. Good job. And then if you can just give me like a voluntary cough, so just a good job. And that is it for the actual assessment of the muscles and seeing if everything works good. I'm going to move on to sensation. So this is the part where I'm just going to touch across your face a few places. I'm going to have you close your eyes at one point, and then you just tell me yes if you can when you feel it. So when you're ready, it'll be like yes. Okay. All right. So the first one is go ahead and close your eyes. I'm going to do it on both sides. All right. So just tell me when you feel it and say yes.
Yes. Yes. Yes. Yes. Yes.
Good.
Yes.
Good. Awesome. All right, this is the fun one. Now we're going on to taste. Have you had any problems with taste, like tasting foods or anything?
No.
All right. So now what we're gonna do is I'm gonna have you stick your tongue really far out. And you're gonna close your eyes, and I have 3 different, sweet, salty, and sour. Okay? And I'm gonna touch it to different parts of your tongue, because actually different parts of your tongue are what deliver the sensation for sweet, salty, and sour. So I'm gonna do different parts, and then you'll put it in and tell me if it's sweet, salty, or sour, okay? So, and I'm gonna keep this out of your way so you don't see which one I'm going into, all right? So the first one, go ahead and close your eyes and stick your tongue real far out. All right. Okay. All right. All right, go ahead. Is that sweet, salty, or sour?
Salty.
Ooh, I don't know if that was the salty one. Let's see. Hold on. Let's try that one again. Ready? Might not have gotten enough on there. It doesn't put a lot. Ready? It doesn't put a lot on your tongue. Unless our video recorder labeled them wrong.
Sweet.
Sweet. Okay. That should have been sweet. And going on to the next one. All right, ready? Go ahead and close. Yep, perfect. All right, ready? Okay.
Salty.
Yep. Very good. And the last one. Okay.
Sour.
Sour. Good job. All right. And you already said you don't have any problems with your sense of smell. You feel like
Right.
you can smell everything good. Okay. And then the last thing are some reflexes, and I'm just going to talk to you about them, okay? I don't have to do them. So do you know when you're eating food and sometimes something goes down the wrong pipe and you kind of cough a little bit? Is that normally what happens for you? Okay, so that's normal. That's a good thing. That's your cough reflex. That's protecting your airway. The other thing is the gag reflex. So like when you're brushing your teeth, if you ever accidentally brush a little bit too far back and it
Yeah.
touches and it makes you gag, yeah. And then your swallow was fine and your bite was fine. So you have no problems with any of your reflexes. All right, so then we're going on to the actual swallowing evaluation portion of it, okay? So this is where you get to actually drink and eat. So, like I said before, we just have, I'm sorry, we have just some water, so we have a thin liquid. Then we move on to a puree, which I picked applesauce. And then we move on to what we call a mechanical soft, and that is something that's a little bit easier to eat. So I picked a banana, and then a hard solid, so I did like a chip because it's hard and dry. And then a mixed consistency though, so that's why I did the cereal with the milk. So we'll start with the thin and kind of work our way up to the hardest one. So for starters, you position yourself sitting upright. You don't need any additional help. You have no problems. You feed yourself. So what I'm actually going to do as a practice here, and I should have my tongue depressor and my light ready, is every time I have you do one of these, I'm going to do the same thing. I'm going to put my hand right on your throat, right about here, and then go ahead and do a dry swallow for me just as a practice. Good. And then I'm going to have you open your mouth. You're going to say, ah. and make sure there's nothing in there. And then what I'm going to use is the tongue depressor to just kind of peek and make sure that there's nothing hiding in there. Okay, so that's what I'm going to do after every single one of these, okay? Got it? And if you forget, I'll remind you. All right, so we're going to start with the thin liquid. So what I'm going to have you do is I'm going to have you take just a small sip first, okay? So it's a lot of water in there, so sorry. And I'm going to put my hand right here. Ready? Go ahead. Very good. And then go ahead and say ah. And let me take a peek. It gets kind of repetitive over and over, but I gotta look. Good, and there's nothing stuck in there, so you got everything good. So the next thing I'm gonna have you do is a regular swallow, like you normally would take a full sip. Good, very good. All right, now have you do ah. Good, and I'm gonna take a peek. Good, good. And then if you don't mind, I'm gonna have you take a couple sips, like when you're thirsty and you're taking a couple gulps at once instead of just one, so like 3 or so. Good job. All right, and then go ahead and say ah. And what I'm doing is I'm listening if you have like a wet sound to your voice, and you don't, so that's normal. Good, up real big, good. You don't have anything extra hanging out in there with you, so that's good. So now what I'm gonna have you do is just a regular sip, a big sip like you normally would with the straw, okay? Just to see if you have any trouble with the straw. Good, and that felt good. So we're all done with that. And go ahead and say ah for me. And I'm going to take a look. Make sure there's nothing in there. There's not. All right. So you did good with that. You just marked down. You did 4 swallows on the consecutive one. Perfect. Any questions so far?
No.
No? Okay. Did good with the thin liquids. Okay. And we did the puree. So next up is the applesauce. So I'll let you do it yourself. And what I'm going to do is the same thing. I'm just going to feel and take a bite. Very good. And then go ahead and say ah. And then make sure you have no applesauce hiding in your teeth or under your tongue, which you don't. All right. Very good. Do you feel like you're coughing or anything when you do that? Or you feel like it's getting stuck anywhere? Okay. All right. So good on the puree. So then we're moving on to mechanical soft. So we got the banana, which if you want, you can use I didn't grab a fork, so if you want, you can use the spoon to kind of scoop up one. Right? Then you have to chew it a little bit. Good job. Do you feel like anything got stuck?
Nope.
Nope. Do ah and open up. Oops, sorry. Good. And your voice sounds good. Doesn't sound like anything's getting stuck or, you know, a very wet sounding voice is what we're listening for. What did I drop? Oh, thank you. Thank you. All right. And then now we're moving on to the regular solid. So that would be like a chip. So I just have a tortilla chip in here for you. So you can take one of those out. And the same thing, I'm going to feel your throat while you do it to make sure that's okay. That's all right. Ready? Yeah, one bite's fine. They're kind of big. I know, sorry. It's a little bit awkward. And you have to do a second swallow. Mm-hmm. That's fine. Sometimes when it's harder like that, it's harder to get down. Let me do one more swallow. Good. And you know what I'm feeling for is where it raises up and goes down when you swallow. And that's what you want to feel. So you can go ahead, if you want to eat that later, you can. I can make it. Ready? Go ah. Good job. Say ah. Good. And I don't see anything else hiding in there. Excellent. And then what we're going to do is we're going to move on to the mixed consistency. So this is the cereal and the milk. So I kept it separate so it was actually going to stay hard. Just put a little bit in there. And for this, I'll have you go ahead and take a bite. And you can just do one or you can do a couple. It's up to you. Whatever you. Good. All down? There we go. Okay. Go ahead and say ah. Ah. Good. All right, let me take a look. Good. Very right, Seela, you did a really good job. You don't have any questions for me? Nope. Okay, so that completes the oral mechanism exam and the clinical swallow evaluation, which you did really good on. And there wasn't really a need for a referral, and your pediatrician didn't think that you had any problem swallowing. But we just wanted to test everything to make sure everything was okay, and everything, you passed everything. Everything was within normal limits, okay? All right, thank you.